afternoon, everyone, and thank you for joining us today at our media update. I'd like to once again welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. To start today's briefing, I'll remind everyone tuning in about the provincial stay-at-home orders and essential trips. Hamilton will remain under the stay-at-home order until at least February 11th, 2021, as announced by the province today. And during that time, residents are asked to not leave their homes unless it is for essential purposes or activities. Those essential activities would be going to the grocery store or pharmacy, accessing healthcare services. We want to be sure that you continue to look after your health and well-being, so please get the care you need. Exercising outdoors, of course, physically separated, and for work where the work cannot be done remotely. So COVID-19, that virus is still active in our community, and we must do all that we can do to limit the spread by avoiding unnecessary contact with those who don't live in our household, so including family, friends, and coworkers. So stay within your own household. It's virtually important for everyone in our community to stay vigilant and continue to follow the guidelines and restrictions as set out by the province. So your actions are making a difference and could possibly save a life, so please continue to do your part. Stay at home, limit your activity outside the home to essential activities only, wear your mask, wash your hands as often as possible, and keep your distance whenever you're near anyone, and keeping that masking on as well. And if you have any COVID-19 symptoms or are not feeling well, stay isolated at home and get tested as soon as you can. And for the sake of our neighbors, our families, our healthcare workers, our essential workers, and our healthcare system, again, stay home as much as you can. Do your part, trust the experts, continue to follow all of their recommendations from our public health team, and we will get through this and hopefully get to another round of vaccination sooner rather than later. I'm going to turn it on now to our Emergency Operations Director, Paul Johnson, for some local community updates. Paul?
Thank you very much, Mr. Mayor. Members of the community may have heard that the province has expanded the number of people who are eligible for emergency childcare. And as such, the City of Hamilton is updating its list and would be able to accommodate those that are now covered by it. The list is extensive. I won't go into all of those because it would take too much time, and they're all listed there on our website anyways, but there has been an expanded list today. And so for those who face childcare issues because of their need to perform some essential work in our community, be sure to visit hamilton.ca/childcare, and all of the information is there. I can tell you that in the City of Hamilton, we do have capacity remaining for emergency childcare, and at this time are not in any sort of a wait list for emergency childcare. So please, if your family requires that, to take advantage of it. We actually do it through our licensed home childcare system. So there are lots of opportunities for it to be actually fairly close, probably to where you live, which is a stronger approach than having maybe one or two sites just located in the city. So lots of good information on our website about childcare in general. Just a reminder that this is the emergency childcare for children who are in school and doing learning in school, but are of younger age and may need a place to go while their families are working. The childcare system for infants and toddlers and preschoolers continues and has continued for a number of months now, so it continues unchanged. From an enforcement perspective, those who follow our charges and more charges that are being laid at private residences. Of course, those aren't listed on our website, but I can tell you that we're receiving lots of calls from the community, and on a reactive basis to those calls are going and attending our residential addresses in Hamilton and are finding a few things. One is still finding social gatherings. So it could be parties or gatherings or dinners or things along those lines. People inviting extended family member over from different residents and people having their friends over, all of which is not allowed. You can certainly gather, of course, with those who you live with. Enjoy their company, find new ways of having some fun together and getting things done together. But in terms of inviting people into your homes from a social dynamic, this shouldn't be happening, and we will be there to lay some of those charges. So the charges we lay are usually either in terms of hosting that gathering, if it's a bit of a gathering, or attending it. And it's all under the violation of that stay-at-home order. So just a reminder that This is a time, I know how tough it is. It's tough for everybody. That generally speaking, social gatherings are not allowed, except if you are a single person or a single parent. And then if you have an exclusive additional household that you're partnered up with, then that is fine. But that is the only kind of interaction that we should be having still. I know Dr. Richardson will talk about our numbers and those who are following them, whether that's at the province-wide level or at the local level, are seeing some improvement, but that improvement can quickly be undone by the spread of this virus. And so we want people to continue to abide by the rules while we're still in this stay-at-home time. And certainly looking forward to town hall and another opportunity to share some information. I'm sure the mayor will remind folks about our town hall this coming Thursday as well, with a couple of special guests talking about our vaccination situation in the city of Hamilton and more broadly. So that will be great. We continue to put out the best information, and I would really encourage people. Everybody now is looking for good information, not only about the pandemic itself, but about the vaccination strategy and how that's rolling out. All of that information is available on our city's website. And so both the great information about vaccines in general and the vaccination approach we're taking here at the city of Hamilton, but also, of course, as we have throughout the pandemic, lots of great information on hamilton.ca/coronavirus about everything that's occurring, what you need to know from a rules perspective, what you need to know from a case perspective, and also just some good answers to questions that people generally have still about this virus, and then increasingly now about the vaccines for this virus. So a plug there for all of the good ways that we're trying to provide information to the community and get it from a trusted source, and one of those trusted sources is the city of Hamilton. Dr. Richardson?
Thanks very much, Paul. So I'm going to go through, do an update about the cases and talk a little bit more about what's happening on the vaccine front as well. So today we're at 8,766 cases in total in Hamilton, 75 new cases from yesterday, and we're currently sitting at a weekly incidence of 97 cases per 100,000 people. And I'm going to come back to that in a moment. We're at 731 active cases for Hamilton now, so that's 7679 or 87.6% are recovered cases, which is good news. There have been, unfortunately, 232 deaths to date, with no new deaths reported today. We are reporting, though, a total of 50 local outbreaks on our website, and 2 new ones were added today. St. Peter's Residence at Shadoke Long-Term Care Facility and Harster Greenhouses were added as well. We have seen a trend of non-outbreak cases trending downwards, and the outbreak cases are continuing to fluctuate, with new outbreaks still occurring. And there's a lot more details on our website, but I'll go into it a little bit further just now. So we do see this decrease in our new case numbers here in Hamilton over the past couple of weeks, which is, of course, a bit of good news. So as of today, as I said, our weekly incidence per 100,000 population is at 97. And our number of cases is at 83. Our reproductive rate is at 0.79. The average number of new cases reported per day and has come down, as you can see, and I suspect this has to do with the shutdown regulations that have been put into place. But despite that, it is absolutely vital that we continue on this downward trend, and we see those local outbreaks come down, because those numbers are still very high. So we do need to remain very diligent, and of course the presence of the variant here in Ontario is something that we're all very mindful about. And again, the following measures is our first line of defense against that particular form of the virus. You may see us have a bit of a larger jump in the number of resolved cases that are posted to our website. As we're doing a deeper dive, as the numbers have come down, our staff are able to focus in more so into the cases that at one time were lost to follow-up. You may see that those numbers become lower for us. We don't like to put those lost to follow-up numbers into the resolved column, because that's not technically the case, and rather they're ones we had that are past their 14 days, but are not, we haven't been able to confirm that they're resolved. So we may be able to clear that up a little bit further in the next few days. Around the vaccines, of course, there is a lot of interest in the vaccines, and we are trying very hard to provide you with the data that we do have, making sure it's accurate, reliable, and that providing data to the public is very important to us. However, I know that members of the media have been asking a lot of questions, wanting breakdowns and that sort of thing. And unfortunately, with the actual system that we're working with right now that the province quickly put together for us hospitals, the whole health system, we aren't yet able to get a lot of that data from the system. So we're working together with other health units and with the province to look at ways that we can provide some further data, and we'll be providing that to you as soon as we can. We will be putting up on our website on a daily basis some information around the total number of doses administered, and then breaking that down by clinic site. And that's a start. And hopefully, as I said, over time, as we work with other health units in the province, that will get better as the system gets better. Just speaking to the vaccine availability constraints that the province talked about earlier today, as you know, they've halted the administration of any new first doses to anyone other than residents of long-term care and high-risk retirement homes. That's the subset of retirement homes that have a memory care unit within them.
Mr. Mayor, it looks like we've lost Dr. Richardson. Maybe we'll pass over to you, and we can go to media questions. When she comes back, she can finish her remarks.
Okay. Thank you for that. And I know I can reiterate Dr. Richardson's comments that although there's some good news, it is still far from over. And so we need to continue to follow the masking and physical distancing and all the recommendations that are still out there, including the lockdown. And unfortunately, that's going to continue until, at least at this point, until February 11th at the outset, maybe longer. We're not sure yet. You know, we all want to see these numbers come down, and certainly the death count is far higher than anyone would want. And so we're hoping that the vaccinations for long-term care residents and staff in high-risk retirement homes is going to be effective, where a lot of the congregate setting virus spread has occurred. You can continue to shop local as well by shopping online for delivery or curbside pickup. So please take advantage of that, and I sense that many people are. And then continue to do the things that most folks don't want to do right now, is to stay isolated. And for a lot of people, that makes for a great deal of uncertainty, and when you need other people the most. And so I encourage you to look after your well-being and mental health. And if you're having challenges or struggles, you can call COAST at 905-972-8338, or the Kids Help phone at 1-800-668-6868. Very important that you look after your health and well-being, mental and physical. And so that I'm sure the doctor would say, get out and get exercise, but also ensure that you look after your health and well-being, you know, with the healthcare system. Don't be shy to call your doctor. Don't be shy to go to emergency should you need emergency. If you're having health issues, don't let COVID stop you from doing that, because they're well prepared to deal with any issue that you have in the hospital as needed. And the paramedics are there for you as well, that have all the equipment and supplies to deal with your challenges and your issues very safely. So thank you for all that great work. If you need more information, again, as Paul pointed out, hamilton.ca/COVID mental health is one area for the mental health side. And on the city's general coronavirus website, you can get a lot of information about supports for businesses, as well as information around the vaccine. And I encourage you to get accurate information about the vaccine. Millions of people have been vaccinated, and there has been minimal problems, other than the typical ones, which is a sore arm and feeling maybe possibly a little weak or queasy for a day or two, not unlike the flu shot, and then all is well. And hopefully that will not discourage anyone from getting the vaccine, because it is ultimately the way that we're going to see our way out of this current dilemma that we find ourselves in. So let's keep working on that, and be sure you get accurate information on the vaccine as we go forward. And that's what the Thursday evening session will be, the town hall will be all about, which is vaccine, and we'll bring in some local experts to tell you all about it. With that, I'm going to turn it back over to Jasmine for some media questions, and then we'll come back and either talk to Dr. Richardson or close out this session. Thank you.
Thanks. It looks like Dr. Richardson's back, so maybe we'll check in with her, see if you want to finish your remarks, Dr. Richardson. We'll just get you off mute there.
Sorry about that, folks. IT systems are interesting.
Can you hear me now?
Yes, we can. Go ahead.
Yeah, full computer crash, but that's okay. Back on. So I was just speaking to the strategy now around vaccination because of the supply constraints that are in place. And so as you heard, the government is focusing the strategy now on two components. The first is to make sure that all long-term care home and high-risk retirement home residents do get a vaccination as soon as possible throughout the province. There's 14 health units in Ontario that so far have not had any vaccine supply. We're very lucky here in Hamilton. Not only have we had that supply on hand, but we have managed to get through and vaccinate all of our long-term care home and high-risk retirement homes. And so vaccine is going to be reallocated as needed in order to vaccinate all those in Ontario by February the 5th. We're also working very hard to make sure that all those who've had a first dose of vaccine do get a second dose of vaccine. And so that is going to continue on as well. And what the province has done is for those who had the Pfizer vaccine, based on expert guidance from the National Advisory Committee on Immunization from the WHO, and now the Centers for Disease Control as well from the United States, they are expanding the interval for vaccination out to 42 days for those getting a second dose. For those who are getting, that's for healthcare workers. For those who live in long-term care homes and retirement homes, they will still get it within the recommended interval of 21 to 27 days. For those who got Moderna, they will be maintaining the 28-day interval. They're also focusing on continuing to vaccinate the residents of remote and Indigenous First Nations, remote and isolated First Nations, I should say, through Operation Remote Immunity, and are going to continue to work with us to look at the data, to go through and make sure we have our numbers right and reallocate vaccine as needed. So our fixed site clinic will be winding down to some extent in terms of only continuing to provide second doses within that window. And the mobile clinics as well are currently being booked so that they can continue to provide the second doses to long-term care home residents within that 21 to 27 day period. So that's it from me, Mr. Mayor. I'm not sure if you have more wrap up you wanted to do.
No, I'm going to turn it right over to Jasmine, and we'll get to media questions. So Jasmine, take it away.
Great, thank you, Mr. Mayor. We have 3 media on the line today, so we'll do 1 question, 1 follow-up like usual. We'll start with Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much. I hope you can hear me okay. Just wondering, in terms of the vaccination efforts in long-term care homes, we are still seeing outbreaks in long-term care, and I'm just wondering if there's like a significant number of people who are staff or residents who are refusing the vaccine because it is not mandatory. Just wondering if you have any information on that particular piece.
Thanks very much, Lisa. When it comes to the vaccine, we're not seeing significant rates of refusal. Our experience is when we're in the long-term care homes that just about 100% of the residents who are able to take the vaccine are doing so. There are some that aren't because they are acutely ill at the time. And you know that we've been vaccinating homes that are in outbreak. And so anybody who's acutely ill with COVID-19 itself would also not be being vaccinated. We've also had really good uptake in long-term care home workers and essential caregivers. And so we're very pleased with that. So we are hopeful that we will start to see an impact from those immunization clinics that have been going on for the last couple of weeks, that we'll start to see that over the next few weeks.
Okay, thanks very much. And my other question is regarding the Cardinal retirement residents. I know we did learn that there was an IPAC report and compliance order issued earlier this month. The home was struggling to fulfill some of the mandatory items in IPAC control. Just wondering how that's going, an update on that home, and have they come into compliance?
Thanks, Lisa. I don't have anything specific on the Cardinal with me today. If you like, we can, Jacqueline can have one of our folks follow up with you.
Sure, that'd be great. Thanks.
Great, thank you. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions today. My question is for Dr. Richardson. Dr. Richardson, I just want to confirm, from what you've said, does that mean no one will be getting any new vaccines here in Hamilton? Like, are we all on second doses now, and do you know for how long, or are there still people that you need to give a first dose to?
Dr. Richardson, we just have you on mute there.
Sorry, it's the 2-button problem now I have with this computer. It's one of those days. Joanna, with this, at this particular time, there is a small group of people who will still be getting first doses. So those are the people that I mentioned earlier, the people who are in the long-term care homes and retirement homes who were ill, not able to have the vaccine at the time. And so we'll go back and work with the homes to get those people vaccinated. As well, we'll be looking at people who may be transferred back to long-term care or retirement homes. As you know, there's an ongoing interplay between hospitals and long-term care homes and retirement homes. So we'll be looking at those couple of groups, working with the province to make sure that we can do those.
And my second question is also for you, Dr. Richardson. So how big of an issue is it that there doesn't seem to be a way for public health to get, reliable and consistent information about who has been vaccinated? Like, how do you know how many people, how many staff you have left to vaccinate if you don't know how many you vaccinated in the first place? Like, how big of an issue is this flying blind when it comes to the data?
Thanks, Joanna. The characterization in terms of flying blind, I want to make really clear to people, we absolutely know who we've vaccinated. That is what the system was set up to do, is to make sure it tracks who has been vaccinated. And so we can go forward and give them the appropriate second dose as we go forward. So we are certainly collecting, the hospitals are collecting information from people that's getting logged in the system, and then being tracked in terms of moving forward, in terms of the interval for when they should be vaccinated again, in terms of the specific vaccine that they did receive. So, when the province designed the system, it's very much been designed on the fly in terms of getting something up and running to support this effort, and they released it in so that we could do those things that you've heard about, and they're continually trying to improve it and be able to get further information from it. So it's not that we don't know all of that information. The challenge that we have is knowing what we'll call the denominator information. So knowing exactly the number of people who are in long-term care homes, retirement homes, exactly the number of staff, exactly the number of essential caregivers. And so we know from when we're in those homes at that point in time, how many people are there and how many people we have vaccinated. And that's where I'm coming from on that front. We know that we're getting near 100% uptake, with the limitations really being limited to those who are ill. We know the number of people that have been designated by the homes as their staff and their essential caregivers at that time. And so we know from the number of people that we vaccinated, we can give you a good, we have a good ballpark that we're doing well in terms of those vaccinations. The challenge is to get really specific with numbers. And so, for example, when we're going into the homes and doing that vaccinating, if a staff person is there and wasn't able to get down to the clinic and got vaccinated during the first round, we can't track those as we go forward. The system needs to be improved to track whether it was a staff person or a resident at that time. We know their name, we know all the details that we need to vaccinate them again, but we don't have all of that very specific information. So as I was saying to you earlier, we get that it's frustrating because we can't tell the degree of information we'd like to have in the longer term. But at this point, it's not in any way impeding our ability to roll out the vaccine program.
Great, thank you, Dr. Richardson. Next question to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi, hope you can hear me. Dr. Richardson, I wanted to ask you about some disturbing reports that have come out today about conditions inside Grace Villa's outbreak when it was going on, including that there were residents who were left to wait 30 minutes for help after falling on the floor or while choking, and were left lying on soiled mattresses, and that some people died simply because they couldn't be hydrated properly. Could you comment on that?
Thanks very much, Maria. As you know, we went through this outbreak with Grace Villa. It's certainly been a very difficult one where we knew that people were very sick, where we knew that They were struggling in terms of bringing in the staffing resources they needed, and we very quickly connected them up with the hospital. We had the appropriate inspection authorities involved so that they could bring to bear all of the resources that they had in terms of supporting these individuals. You know, it's absolutely tragic, the sort of things that we hear about from these homes in terms of outbreaks. Graceville is one of them. Of course, we've heard of other ones, both in Ontario and across Canada over the course of this. And you know, we very much are looking forward to the province continuing to look at long-term care homes and retirement homes and what the reforms are that are needed as we go forward, and continue to work with our partners to bring in all the resources that we possibly can to support the people in these homes.
Thank you. And for a follow-up, I'm just wondering if you can speak to how this happened under Public Health Watch, and if at any point Public Health felt the home needed more help than it was getting, such as through the Red Cross or the military.
Thanks, Maria. So just to be clear, our job is to look at the infection control and disease control aspects. The care of the residents in the home is the responsibility of the home and the licensing authority, the Ministry of Long-Term Care. And so when we're looking at those elements, we absolutely, right within the first day or so of this outbreak beginning, we called in the authorities to say, we need you to look at this home. They were expressing concerns about their ability to staff. They needed support. They were paired up with a hospital, and the hospital was asked to come in, look at how they could support. So throughout those early days, all the way through, we were definitely pressing to say they need support, they need more guidance, they need more of those supports as things went on. And ultimately, that is up to their inspecting authority to make sure that they are getting the resources they need and that there's the care they need, but absolutely as well, the partners around the table here in Hamilton, the hospitals, home and community care, they were coming forward with agency staff to support that facility and asking that more be looked at.
Great, thank you, Dr. Richardson. We do have a little bit more time, so we'll go through again for one more question each. First question to Lisa Pileski, CHML. Lisa, if you would like another question, you can go ahead.
Hi, thanks very much. I'm actually okay for now. Thank you, though.
Great, thank you. We'll go next to Joanna. Joanna, if you would like another question, you can go ahead.
Hi, thanks so much. I appreciate the extra question. I'm looking to find out how many doses we have given out of the vaccine. The last count we got was last week, which was 13,400. What are we at as of right now?
Thanks, Joanna. So through the mobile site, I believe we're at 4,697 doses having been given out. Have to check in with HHS where they are in terms of numbers through the fixed site clinic, but 4,697 through the mobile site.
Great, thank you. And we'll go next to Maria. If you would like another question, Maria, you can go ahead.
Thank you very much. Dr. Richardson, can you speak to whether those inspections you mentioned actually took place? And as well, if you can kind of share what your message would be to families who've lost loved ones and what are being described as entirely preventable deaths.
Thanks very much, Maria. I mean, our hearts go to all of those who have family in long-term care, and especially those who have experienced the challenges of a bad outbreak such as that has affected their loved ones, and they've lost their loved ones through the course of that. It's a circumstance that none of us would want our loved ones to experience, and none of us would want to go through. In terms of the inspections, yes, those did go on with our staff, our joint inspections that we had begun doing much earlier in the pandemic with our hospital colleagues, so that we could bring all the resources that we had to bear. And then we had the responsible authorities throughout the outbreak at the table with us, and so they were able to be aware of the information on what was happening in those facilities.
Great, thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I'll pass things back to you.
Thank you, Jasmine, and thank you to our media partners and to Dr. Richardson and Paul Johnson for their answers, and to Bill Custers and the entire team at Cable 14, as well as Clear Cable, all of whom have helped ensure that these availabilities run as smoothly as they do. So thank you for all of that. And again, if you want accurate information on COVID-19 and our response, please visit the hamilton.ca/coronavirus website for all the information you need on vaccine or supports and all mental health supports, as well as financial supports that you can find there to ensure that you're taking advantage of everything that's out there to help you get through this dreadful vaccine and the time that we're struggling right now. And if you haven't already, you can further help limit the spread of COVID-19 by downloading the COVID Alert app through the App Store or on Google Play. Very helpful for you to have that, to know if you've been in contact with anyone that has been identified as having COVID-19. Certainly a quick way for you to realize that and possibly protect yourself in that instance, should you need to. So we'll continue to work together to protect one another, and I encourage everyone to continue to do that. We cannot stop. We cannot quit. We have everything to look forward to in terms of getting past this, but we have to get through this phase of lockdown and isolation, of staying within your own household. As difficult as it is, there are a lot of supports and helps out there for you, so please take advantage. And in the meantime, we will see you on our next media briefing, February the 1st, 2021 at 3 p.m. And this coming Thursday at 7 p.m., along with Cable 14 and our guests, Dr. Richardson and Paul Johnson, as well as some special guests relative to vaccine and the effectiveness of the vaccine and what it does and does not do. We'll be there to answer any of your comments or questions relative to the effectiveness of the vaccine beyond the availability. And that's certainly in the hands of the federal and provincial governments. And we're hoping that they get their supply issues sorted out so that we can get these vaccines into the arms of as many as we can, as quickly as we can. Thank you all for joining in, and we'll see you next February the 1st, 2021 for the next media briefing.